Welcome back to our final video of our series on supraspinatus tendinopathies. Today we're going to be talking about specific exercises during each of the 3 phases of our rehab plan. So as we talked about in the last video, our first phase is going to be more isometric strengthening and regaining range of motion. So 2 of the main exercises I like to use during this phase are going to be isometric external rotation and isometric abduction. For this exercise, all you need is a wall. You're going to stand close to the wall with your elbow tucked to your side. You're going to rotate the back of your fist into the wall and hold that position for 45 seconds. Recent research has shown that doing 45-second isometric holds during the initial phase of rehab can help to desensitize the tissue and also increase its load tolerance. So we would do a 45-second hold in this position. Once that was done, we'd then step away slightly from the wall, and we're going to raise that arm 15 degrees off the hip, lift the fist into the wall, and hold that position for 45 seconds, an isometric abduction exercise. The nice thing about these exercises are you can control the amount of force so that we're at sub-symptom threshold, but we know that we're targeting the right tissues. So that would be 2 of the phase 1 exercises. As your pain sensitivity decreases and your range of motion increases, we move into phase 2. During phase 2, we do what are called isotonic exercises, which means that we're strengthening the muscle and tendon through its entire available range. So 2 of my favorite exercises during this phase are going to be side-lying external rotation and side-lying abduction, which you can do with or without a weight. So if I was to lay on my side with my bad shoulder up, I would hold my weight in this hand, keep my elbow tucked to my body, rotate upwards, and then slowly lower back down to neutral, focusing on engaging the muscles in the back of my shoulder. And we can add weight to this exercise as able to progress the strengthening. Exercise number 2, your arm's going to be along your hip, and we're going to do a side-lying shoulder abduction. With this one, you're going to raise that arm up to shoulder level, and then slowly lower it back down to the hip. Once again, we can add weight to this exercise to make it more challenging. One of the key things to watch with this exercise is that you're not shrugging your shoulder to create the movement, but rather making it a pure abduction, which will really engage that supraspinatus muscle and tendon. And then once we get to phase 3, we're looking at regaining functional movements and functional activities. So one of my favorite exercises during this phase is a wall slide. So we do a wall slide facing the wall. Pinky sides of the forearms are going to be against the wall, and you're going to slide those forearms up while maintaining core activation, and then lower the arms back down. There are a couple progressions to this one. We can add a band around the wrists to encourage a little bit of external rotation activation during the movement, and we can also use a foam roller on the wall to help guide that movement as well. The goal of this movement is to retrain that overhead movement pattern and to also help train the shoulder blade to properly upwardly rotate, which can reduce the frequency of impingement and help prevent the recurrence of this injury. The other exercise that I like during this phase is a dumbbell shoulder press. This exercise allows you to push weights overhead, slightly lighter than a barbell would be, and it allows you to keep your elbows in a more neutral position as opposed to a flared position with a barbell, and it translates really well to reaching up to the top shelf for a coffee mug, as well as doing any type of cleaning or overhead repeated tasks to help build strength and endurance in that position.